Hi guys, I'm Dr. Andrew Iraniha. Today I want to talk to you about my new laparoscopic technique to repair the diastasis recti and whether this procedure can be combined with other cosmetic procedure at the same time. So I will go ahead and talk to you about the different scenarios. So there are patients that present to my office and they do not want to have tummy tuck or mini tummy tuck, and they're really interested to have a diastasis repair with laparoscopic technique, but also they have excess fat in the anterior abdominal wall on both love handle areas and the back region. And I can perform liposuctions initially and clear those fats from the anterior abdominal wall side and back, and then perform laparoscopic repair of the diastasis recti through the little holes in the lower abdomen. I can even use those incisions to do the liposuction so they don't have excess or extra scar tissue in the lower abdomen. And that way, not only they get a tighter abdomen and have a repair of the diastasis recti, but also they get a better contour because of the liposuctions and better cosmetic outcome. The other type of patients are the ones that they have a little excess skin, and these patients, what we can do is perform the laparoscopic repair of the diastasis recti, and at the end just make a small incision in the bikini line and just slightly raise the skin off of the muscle in the lower abdomen and pull the skin down and cut the extra skin, and that way they can get a little tighter skin as well as laparoscopic repair of diastasis recti without having tummy tuck or mini tummy tuck, and that way it decreases their recovery time and improve their pain post-operatively. The other scenarios are people present with the sometimes the scar tissue from previous C-section, and that the scar tissue is widened or they have a step off and they don't like that scar tissue. In that case, also I can perform laparoscopic surgery, repair the diastasis recti, and at the end revise the skin. And during that process of revision of the scar tissue, then I can even pull the skin a little bit and remove that. And the last situation is the people who have a very long diastasis recti that starts from the upper portion of their abdomen right below the rib cage all the way down to the pubic bone. And those people with the laparoscopic procedure, I'd be able to close the diastasis all the way from the top to maybe 3 inches below the umbilicus. But at the end of the procedure, I again make the incision through the previous C-section scar tissue and raise the lower portion of the abdomen, and then close the rest of the diastasis recti on the from the top of the muscle, and then pull the skin down and cut the extra skin and repair that skin and open wound. And that way they don't have that major dissections and surgery that we do during the tummy tuck and mini tummy tuck, so therefore they have a better recovery time, but at the same time because I pull the skin and cut the extra skin, they have a better cosmetic outcome. So these conditions also can happen combined. So we can do liposuctions with laparoscopic repair of the diastasis recti, and then revise the lower abdominal scar tissue and pull a little excess skin without doing a full tummy tuck. So if you have any question or you're interested to know more about these combination of procedures that we can do with the laparoscopic repair of diastasis recti, please contact my office for virtual or in-person consultations at 949-646-8444. Thank you.